Hi, I'm Dr. Brian McKay of CoreHealth in Darien, and I want to introduce you to a program called Neuropathy at CoreHealth. And what it is, we are the largest provider of home-based treatment programs for neuropathy sufferers. We're talking about diabetic neuropathy, chemo-induced neuropathy, idiopathic neuropathy, autoimmune neuropathy, alcohol-induced neuropathy, several different neuropathies. They all respond to the different programs that we offer here. And what I'd like to do is share with you some pretty valuable information, because what we found is that when we partner up with the people who come into our program, they get better results because you are better educated. So if you got a couple minutes, this is going to be about a 20-minute long video. Let's share some vital information with you. So what we have to do here is we have to address the underlying causes of your neuropathy. Then we have to rebuild and restore the nerve function. And at the end of it, we have to maintain the proper nerve function. So there isn't a pill on the market that really does that. I mean, most of the pills these days are anti-seizure medications that have shown to be somewhat efficacious with the results, and often short-term, or maybe you gain a little bit of weight. But what we have here is a program that, again, addresses the underlying cause. We rebuild and restore nerve function. Very important. Medication is not going to do that. And then we maintain the proper nerve function with ongoing therapy done in your own home. I think that's a big savings. So just think of it here. There's a plant. It doesn't get water. It doesn't get the nutrients. What happens? The leaves die. The plant dies. You give it the right nutrients, the right environment, and the plant comes back. Is your body any different? Chances are no. What we're going to do is we're going to show you the therapies that are going to bring you back to life. And it takes a couple weeks. It's not going to be a short fix, but I think it's a rewarding journey, and we're seeing tremendous success for our patients, and we hope we get the same results for you if you do decide to become a patient here at Neuropathy at CoreHealth. It's a great program. So take a look over here. On your right-hand side, you have a healthy nerve, a less than healthy nerve, and then not so healthy nerve. And what we have here is we have blood flow, and the blood flow to the nerve in the top right image is very healthy. Because that allows it to bring oxygen and nutrients to the nerve itself. Now the second one starts to die off a little bit, and we don't have as much blood flow. The blood flow becomes inadequate. You have to think someone who's gone through diabetes or chemotherapy or autoimmune disorder that caused their neuropathy is going to have a compromised system. So the blood flow is not adequate enough, which makes this it becomes more and more of a problem. It doesn't become like I could take it to leave and my headache goes away. And the end result is that nerve starts to die off. The brain can't communicate with the body part, and the body part can't communicate back with the brain. So it's a pretty severe thing, and unfortunately, there's really no medication that addresses it. I mean, you can see all the commercials with Cymbalta, Lyrica, but there really is no one medication that's going to make a difference here. So it takes a several-prong approach. We have 5 layers of different therapies that we apply in the Neuropathy at CoreHealth program, but we do see results. So restoring nerve functions, that's a really important thing to do, and we have some really great technology called Rebuilder. Now Rebuilder you do require to have a prescription to get it. You just can't call up and get it. But the Rebuilder works on a couple different levels. It's a rather simple looking device, but on one hand it's the electromuscle stim, which you can get any physical therapy office. Our office here, we do it. And what that does is like a passive exercise. Now, if you haven't been up walking around because your feet hurt, you're going to need to exercise. And the electromagnetic stim part of the Rebuilder is wonderful for that. So it's a kind of concurrent treatment where you're getting the muscle stimulation, but you're also getting a healing environment created at 7.83 megahertz, which allows the nerve to regrow. Yeah, you can regrow nerves. It happens all the time. Axons will grow, all nerve cells will grow. So to do that, we have to create the healthy environment for the nerve to heal. You have to increase blood flow and stimulation to the nerves. Then you have to re-educate the nerves. So the Rebuilder checks a few of those boxes off if you really think about it. So by using the Rebuilder, and this is something we're going to have you use at home every single day. I mean, we're not going to mess around here. If you want results, you have to do what we say. So again, here is, like I said, we have a 5-part therapy program, and we find a lot of success with it. But neuropathy, you got to focus on many levels. You got the nutritional level, the nerve level, the blood flow level, and even the mental level. Because when you're in pain all the time after having diabetes and cancer, well, you need a little bit of rebuilding on that level too. So the medication, it's not a comprehensive approach. It's just the only thing that most people today, okay, well, your doctor says take Lyrica, take Cymbalta, gabapentin. They're not solving the problem. They're not going to reverse out the symptoms as we can do with the program. So the infrared therapy creates angiogenesis. That's where new blood vessels are created. The electrotherapy is where we repair the muscles through the electromagnetic stim. And then we also work on that nerve function with that 7.83 megahertz that heals the actual nerve. So the in-clinic protocols are a little bit longer to go into. We offer pulse electromagnetic field therapy. This is something you may have seen on Dr. Oz, cutting edge technology. And again, let's go. How do we increase circulation and heal tissues? Angiogenesis is done with a couple different things. In office, we use LLLT. It stands for cold laser, class 4 cold laser therapy. This is something we have to do in the office because we cannot send you home with a $40,000 piece of equipment, and you need to be trained how to use it. Angiogenesis is accomplished by near-infrared therapy. Near-infrared light therapy will stimulate oxygen and blood flow, and in doing so, the increased oxygen makes the tissue more enhanced, kind of pops it up, and then what that does allows for production of nitric oxide. Nitric oxide is a major thing. So the light therapy, what you have here is the light therapy on a localized level produces oxygen. The oxygen also will help stimulate the mitochondria. Mitochondria is little tiny parts of the cell that creates power. If you don't have power, well, lights can't come on if you don't have power. What we do is we use this near-infrared light therapy to stimulate blood flow in the endothelial layer of blood vessels. Very important here because that gets through the cell wall, and that's what allows us to produce nitric oxide. And nitric oxide is what you need to get the optimal level of blood flow. If you have the hardened arteries, you just can't get that. It's softening, it doesn't allow for better blood flow. You lose nitric oxide by about 40-50% at age 40. So like everything else, things just keep getting better as you get older. I'm part of that problem too. And what happens is, so the light therapy increases circulation on the localized level, and the tissue is allowed to heal. So if you've got something going on with your leg, something going on with your knee, you use infrared light therapy at home, very passive, and there's no pain involved with these things. They're very passive exercise therapies, but they've been proven time and time again to stimulate angiogenesis. Very important. I mean, I can't tell you, when you get, what you see here in the image on the right is how when the arteries harden, it makes it more difficult for the blood flow to get through. Let's remove that impingement and make the blood flow better. And also too, as a little hint, while you're increasing your nutritional levels, that's also going to fortify the blood to go through there better. So near-infrared light therapy has been used in Europe for years and years and years. And similar to how we put up a slide before about how you have plant dying. You give it light, you give it water, you give it nutrition, the plant comes back. Well, your body's the same way, okay? It's a very amazing thing, but you give it the right nutrients, the right light, and you see miracles, and we see them all the time here at Neuropathy CoreHealth. And again, we're trying to educate you on this. The nerve and muscle re-education part builds strength and stability. You're losing balance whether you believe it or not. If your feet are not working, if the feet cannot give information back to the brain, you are losing balance. Very careful not to lose balance, but how would you know? We've had patients sprain their ankles, not even be aware of it, because the nerves are that dysfunctional due to neuropathy. So we don't want that for you because it will lead to falls. So we mentioned a rebuilder. The rebuilder is what you see this pretty lady have in her right hand. That's the technology. Now, it's not only being used by us. It's not some fly-by-night type of operation. Cancer Treatment Centers of America are using it. We're using it. Cleveland Clinic, Mayo Clinic. It is being used across the country to re-educate nerves and build strength. There's two functions that it does. The muscle stimulation, but also to heal the nerve. Both are accomplished with daily treatments using the rebuilder. Again, you need a prescription for it. Very valuable tool. And so I'd like to say that we're on the cutting edge, but that's not just it. We're searching every day for new and better answers to heal neuropathy. The low-level light therapy, the cold laser, as I like to call it, is a jolt, a super jolt of energy, again, to fire up the mitochondria, but that's done in office. And believe it or not, that only takes about 3 minutes to do a treatment. Just to give you an idea of that's been around for a long time, but very few medical doctors are really aware of it. So that's kind of sad like that. Now, the metabolic programs for nitric oxide production are one where there are certain supplements we have found that will help produce besides the light, you get the light coming into the blood vessel through localized near-infrared therapy, but you also have to heal from within. Heal from without, heal from within, you can have a much more beneficial, a much more lasting result. So in order to accomplish that, what we do is we do provide a nutritional program that's part of the Neuropathy CoreHealth whole entire program. And you don't take one part out and not do it. And what we're talking about here is nitric oxide. Nitric oxide is wonderful. I'll also give you an idea what nitric oxide does. I'm sure you're familiar with Viagra, Cialis. It opens up the blood vessels. And basically, we're giving you a natural supplement to open up the blood vessels. So if you want to take another pill, then the pill you would have to take to do so would be a Viagra, Cialis. But it does make a major difference in the quality of your life. I think that's something we should touch upon is, what is it you want out of your relief? Do you want to dance with your spouse? Do you want to go for a walk and not have to sit down and be tired? Do you want to play with your grandchildren and not feel pain? Well, I think that's more important to define right now is what it is you're looking to do when you have reversal of symptoms of neuropathy. And that's what we're looking for. I'm not here saying we're going to cure your neuropathy. I don't cure neuropathy. Our program does not cure neuropathy. What it does is it helps reverse some of the aging process that goes along with being immune compromised through diabetes, chemotherapy, autoimmune, the aging process itself. So that's what we're about here, is reversing the symptoms. Now, I'm not saying I'm a cure, and make that clear. If you want a cure, X out of this right now. But we're here to help, but more importantly, we are here to educate. We're going to educate you so you know you're going to know more than your doctor about neuropathy, because we're going to show you every step of the way. This is not the only thing you're going to hear from us. We'd like to send you home with home health education, because again, the more informed you are, if you got to get rid of that pill mentality. The pill mentality, we take a pill, my symptom goes away, I'm better. It doesn't work. Our in-clinic protocol as part of the Neuropathy CoreHealth program is we do need you here once in a while. Over the 90-day program, we're going to ask you to come in at least 8 times, once a week for the first 4 weeks, and once every week thereafter, where we can do additional therapies. We're going to work with our physical therapist on balance, on exercises, because you will be doing home exercises. Don't think you're going to start this program and get results unless you're committed to doing home exercises as well. We want you to stay out of here. You're going to come in, get better, let's stay out of here. You have better things to do with your life, I'm sure. And we've got a pretty busy schedule here. Let's get you healthy and let's get you out of here. It's very important that there's a beginning, middle, and end to what it is we do here. So the in-clinic protocol, we do vibratory plate, which again stimulates the muscles at a rate you cannot believe. We're going to do laser. We're going to do hydro massage. We're going to do stretching. We're going to do balance therapy. You're going to have a pretty full plate when you come in here. And that particular part of therapy, just to give everyone to know what does it cost, the in-office part is covered by Medicare completely. You would need a prescription from your doctor for that program. But again, let's go over your motivations. You want to get better, you want to feel better, you want to go fishing, you want to go dancing, you want to go bicycling, jogging. How about just becoming more active? How about enjoying life? How about starting to reverse that cycle? How about getting off the couch and doing something instead of just letting the aging process take you and sweep you up? What I want to do now is I want to turn it over to what real patients have to say.
Hi, my name is Diane, and I've been at CoreHealth now for 3 months, and actually I'm getting better and better. I was skeptical in the beginning, but they're really helping me. If you're skeptical, I think you should try it, and I think you'll find good results. I'm very happy that I did it.
Hi, I'm Martha, and for years I've had peripheral neuropathy. It started to worsen recently. By some coincidence at the same time, my husband saw an ad for a free seminar dealing with an alternative to medicine treatment for it. The seminar proved very enlightening, convincing, and very informative, enough to give it a try. After 11 weeks of treatment, I actually feel like the neuropathy is under control and not interfering with my lifestyle. The doctors and staff proved very knowledgeable and extremely concerned and very helpful. If you have any doubts, give it a try and you will be pleased. Of course, everyone reacts to treatments differently, but it's a no medicine treatment and without any side effects.
Hello, my name is Kathy and I'm a retired nurse. I've had neuropathy for about 6 years now, and I started treatment at CoreHealth about 3 months ago. I'm feeling much better now. My symptoms have decreased significantly and my quality of life has also increased significantly. The staff here is very professional and I certainly wouldn't hesitate to treatment at CoreHealth. It was a great decision.
Hey, good morning. My name's John. I've been with Core for 8 weeks, and when I first came, my pain level, my discomfort was between 8 and 9. Since I followed the protocol without drugs, I'm down to 3 or 4. I can sleep at night, I'm comfortable, and it works. The people here are very professional and the facility is wonderful. I recommend it highly. Thank you.
Hi, my name is Margaret. I have been suffering with neuropathy for over a year. I started treatment at the CoreHealth 6 weeks ago and my condition has improved dramatically. I have more strength and endurance in my legs. The staff is very professional and I am very happy.
I suffered from neuropathy for about 2 months before I came to CoreHealth, and I went through the program, and I'm significantly better to the point where it doesn't bother me on a daily basis, and really happy with the performance. And I recommend CoreHealth to anyone that's suffering with neuropathy. They treated me very well, respectively and professionally, and I'm grateful for the help.
All right, so it's my hope that you have a little bit better understanding of what neuropathy at CoreHealth is all about. Education, diligent work on our part, diligent work on your part, but the idea is to get the results where you're not getting elsewhere. We have many, many more testimonials. You want to see more testimonials, more than happy. Hopefully by now you've got the facts, you've got a chance to think this over and see if it's right for you. That's your decision. It's not something we're going to force upon you. It's up to you to decide whether or not you want to proceed. Again, hopefully you've been presented with enough information and that you do trust us that we can deliver on what we say we can. Our goal is to add quality to your life. I guess the biggest decision you have to make is, one, do you want to change the way you are now and prevent it from getting worse? And if that's the case, Neuropathy at CoreHealth is probably the best program. We are Fairfield County's leading home-based provider of neuropathy treatment programs, the largest and with the most experience. So it's your decision to make. We'd love to help you. If you have any questions, you can ask Dr. Brian, that's me, or Dr. Mark. We're the two doctors who are oversee this whole entire program. We're here to help you. Neuropathy at CoreHealth is basically helping people just like you feel better. I invite you to make a decision. If not, ask away any questions you may have. We're here to get you the help, but also to educate you as to what it is we can do to help. Thanks very much. Have a good day.